Struggling with scoliosis and wondering if weightlifting is safe? You're not alone. Scoliosis can make physical activities challenging, especially weightlifting. But did you know that weightlifting can actually help strengthen the muscles around your spine? It can also improve your posture, making daily activities easier. Understanding scoliosis and its impact on physical activities is crucial. The sideways curvature of the spine can cause discomfort and imbalances. Factors like age and severity of the curve affect how scoliosis impacts you. This understanding helps create effective physical therapy programs. Scoliosis is a condition where the spine curves, mainly in the middle and lower back. Even mild scoliosis can cause muscle aches and pain, making it hard to stay active. Treatment options include braces, physiotherapy, or even surgery. These treatments influence what exercises and activities are possible. Patients often feel back pain and discomfort, affecting their daily lives. Proper medical care and physical therapy are essential for managing scoliosis. Physical challenges from spinal curves affect movement and exercise choices. Core and back muscles are impacted, changing how you engage in strength training. Discomfort and low back pain make resistance training more challenging. The curve of the spine affects posture and movement, influencing exercise performance. Specific exercise plans can help manage muscle imbalances and reduce pain. Building core muscles and keeping the spine aligned are key goals. Activities like yoga, ballet, and physiotherapy improve posture and movement. Low-impact activities and resistance training ensure safety and effectiveness. Avoid high-impact sports like football and gymnastics to protect your spine. Exercises with heavy twisting or extreme bending can worsen symptoms. Consult a physical therapist or ScoliSmart specialist for a safe workout plan. Proper form and posture tips help manage discomfort and improve movement. Weightlifting won't slow down scoliosis progression but can improve muscle strength. Spine strengthening exercises support the thoracic spine and improve posture. Barbell strength training, with professional guidance, can enhance spine health. Always consult healthcare professionals before starting a scoliosis weightlifting program. Focus on safety and proper form to enjoy the benefits of weightlifting with scoliosis.